Hello, my name is Whitney Duncan, and I am the team lead at Deaconess Clinic Wellness Solutions. Today, we are going to be covering skin cancer and UV protection. The month of May, which is actually coming up, is Skin Cancer Awareness Month. And with that, and the summer months arising soon, it's important to know how to protect you and your family from the sun appropriately and what can happen if you do not take those important steps. Please remember at the end of the presentation, there is a mandatory quiz that will need to be completed. So we're going to go over some of the objectives of what we are going to learn about today. We're going to talk about what really is skin cancer, some quick facts about skin cancer, how to identify factors that increase or decrease skin cancer, also how to identify skin cancer, and then the ABCDEs of moles and melanoma. I'll go over a few pictures with you on how to assess yourself on different moles, maybe freckles that are on your body, and then the benefits to spending time outdoors and such. Let's go over what is skin cancer. Skin cancer is the out of control growth of abnormal cells in the epidermis or the most outer skin layer caused by unrepaired DNA damage that triggers mutations. The main types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and melanoma and Merkel cell carcinoma. Two main causes of skin cancer are the harmful ultraviolet rays that come from the sun and the use of UV tanning beds. The good news is that if caught early by a dermatologist or your primary care doctor, it can be treated fairly easy, hence the importance of self-checks, screenings, and just keeping an eye on any moles or skin marks on your body. And we'll go more into detail about that in a little bit. So just some quick facts. Before we begin, I wanted to take the time to run through these about skin cancer that you may or may not know about. 1 in 5 Americans will develop skin cancer by the age of 70. More than 2 people die from skin cancer in the US every hour. Having 5 or more sunburns actually doubles your risk of melanoma or developing melanoma at some point in your life. When detected early, the 5-year survival rate for melanoma is 99%. More people are diagnosed with skin cancer each year in the US than all other cancers combined. If you regularly use an SPF 15 or higher sunscreen, this will actually reduce the risk of developing melanoma by 50%. Men aged 49 and under actually have a higher probability of developing melanoma than any other cancer. And then women aged 49 and under are more likely to develop melanoma than any other cancer except breast and thyroid cancers. On the screen, you'll see a number of risk factors that can increase your chance of developing skin cancer. There are a number of things you can do to help find it early and easier to treat. Exposure to ultraviolet rays, or known as UV rays, is thought to be the major risk factor for most skin cancers. Sunlight is the main source of those UV rays, and that doesn't include those indoor tanning beds. Tanning beds give off UV radiation, and this radiation can damage the DNA in your skin cells. And if enough damage builds up over time, it can cause cells to start growing out of control, which would lead to kind of what we discussed earlier of how skin cancer develops. If you use tanning beds before the age of 35, your risk of skin cancer increases by 75%. Sunburns. So sunburns accelerate skin aging and can be one of the leading causes of the majority of cases that are diagnosed with skin cancer. A sunburn is a sign that you have actually damaged your skin. What your skin type is can also increase your chance of skin cancer. According to the Fitzpatrick skin typing developed by Harvard Medical School physician, there are 6 types of skin, ranging from very fair to very dark. No matter what your skin type, UV radiation from the sun and other sources can cause dangerous, lasting damage on your skin. However, the fairer you are, the more at risk you are for developing skin cancer if you don't take the appropriate steps to really protect that fair skin. Genetics. So genetics, in some cases, skin cancer is hereditary and can cause an increased risk of developing the disease, and it can actually be passed from parent to child. It is estimated that roughly 5 to 10% of melanoma cases are hereditary and caused by a gene variant or a gene sequence in our DNA. Atypical moles. An atypical mole is not skin cancer, but having these moles is a risk factor for developing melanoma. Although rare, melanoma can rise in association with atypical moles, and that's why it's very important to be aware of these moles, to get them checked by your dermatologist, and just watch for any changing moles. Organ transplant. Organ transplant patients are at a higher risk for developing skin cancer compared to the general population. The higher risk is actually caused by their immune system being a little bit suppressed by medications, which those medications are essential to anybody that has had an organ transplant to prevent graft rejection and optimize graft survival. But because these medications suppress the immune system that fights off infections and prevents the development of cancer, transplant recipients are at an elevated risk for infection in certain cancers, one of them being skin cancer. People with blonde hair or red hair are more at risk for developing skin cancer. There is a genetic risk because there's a higher chance of having gene variants in that DNA. And redheads typically can carry mutations in that gene that could cause skin cancer later in life. Doesn't mean that they will, it just gives them another risk factor. So now that we've kind of talked about a few of the risk factors that can cause or increase your chance of skin cancer, let's talk about some factors that can decrease skin cancer. Every day, please use sunscreen with an SPF of 15 or higher. This will also not only protect your skin from the sun, but it also prevents premature skin from aging caused by the sun, including wrinkles, sagging, and age spots. You should apply the sunscreen 30 minutes prior to going outside and then reapply every 2 hours. Men and women and children over the age of 6 months should use sunscreen every single day. Even if it's cloudy, even if it's going to rain, it is still very important to protect that skin no matter what. Clothing can actually be a huge protective barrier to the sun. Clothing actually absorbs or blocks that harmful UV radiation from the sun and remains one of the most effective forms of protection. So when shopping for apparel that can effectively shield you from some of those harmful rays, keep in mind the color. Dark or bright colors keep UV rays from reaching your skin. Densely woven cloth like denim, wool, or synthetic fibers are more protective than the sheer or thin clothing. Your clothes should also fit loosely because tight clothing can stretch and reduce the level of protection. The more you are covering your skin, the better. Protective window film can actually also be a way to decrease your risk of skin cancer. Sun rays can penetrate window glass. And if you're sitting right next to a window on a sunny day, those rays can actually damage your skin. Window films can actually block up to 99.9% of that UV radiation. The Skin Cancer Foundation actually recommends that you see a dermatologist once a year, but more often if you have a family history or have a higher risk of skin cancer. The annual exam will be done by a dermatologist and will be a full body exam. Doing monthly self-exams can also be a huge preventative measure, looking for new growths, a mole, perhaps a spot or a sore that is itching, hurts, scabs, or bleeds. If you do have an open sore that does not heal within a few weeks, definitely keep a watchful eye for that. And then make sure your dermatologist knows about it as well. And last but not least, try to maintain a really healthy diet, getting in different vitamins like vitamin C, E, A, zinc, omega-3 fatty acids are just a few of the antioxidants that many dermatologists will actually recommend including in your diet to really help prevent skin cancer and build up your immune system. Like we talked a little bit earlier, identifying skin cancer at the earliest stages can increase the chance for a complete cure. Most melanomas can be spotted as soon as they arise if you know what you are looking for. So make sure to watch for changes in a mole, know what is normal for you, and when something does change, that is often the very first sign that you should talk to your healthcare provider. Most people do have a number of brown or dark spots on their skin, like freckles or birthmarks or moles. And almost all of those spots are very normal, but some can be skin cancers, or at least the start of it, and have those cancerous cells in them. There are the ABCDEs of moles and melanoma to help you remember specifically on what to look for when you are performing those monthly exams on yourself, a family member, things like that. So let's first go over the A. So asymmetry. Most early melanomas are going to be asymmetrical. A line through the middle would not create matching halves. So as you can see, the one on the left is very asymmetrical. And then on the right really shows you what a symmetrical type of mole, probably normal, not cancerous, would look like. And then the asymmetrical one right next to it really can show you the difference of, if I draw a line through right here, then it's not going to be identical from that other side, and same with this one. So now we're going to talk about the border irregularity of a mole. The borders of early melanomas are often uneven and may have a kind of scalloped or notched edges. So like the one again on the left, the border is kind of humps around a little bit and is not have a, very symmetrical, again, type of border. And this one really shows you again those differences. The next one is color variability. So if you notice varied shades of brown, tan, or black are often the first signs of melanoma. However, as melanoma progresses, the colors red, white, and even blue may appear, which you can kind of see in this one. That it has really kind of changed. This was the original one, and that this has kind of changed over time. And you can see the color differences a lot there. Diameter. The diameter, so early melanomas tend to grow larger than normal moles, generally at least to the size of a pencil eraser. which would be about 6 millimeters or 1/4 of an inch in diameter. One suggestion that I have always suggested to people, if you start to notice a mole maybe look a little bit different than what you had remembered before, take a picture of it on your phone. Then it can timestamp it, and then maybe in a few weeks go back and take another picture again to see if that mole has grown or anything like that, because that can definitely be a sign. Evolution is the E part of the ABCDEs. When a mole changes over time in size, shape, and color, or begins to bleed or scab, make sure you talk to a doctor or your dermatologist if you see any of those changes. Again, that can be a really big sign, and taking that picture can really then also show your doctor, okay, yes, this has really changed over time and could be something that they may want to look at more in depth. So now that I've given you a lot of this information, you may be thinking, well, should I even spend time outdoors if it can increase the chance of skin cancer? And the answer is yes, you should spend plenty of time outside, but just do it by being safe and being aware, letting your family know, educating friends, coworkers, things like that, especially if you're in a job that is primarily working outside, and that is when it's 20 degrees, when it's 90 degrees, things like that. You definitely want to be aware of just protecting yourself. So actually spending time outdoors can improve your overall health and wellness. The outdoors offer many opportunities to be physically active, promote mental health, and stress reduction. It is important to protect yourself against those UV exposures by practicing some of the things we talked about earlier. UV rays from the sun can stimulate the production of vitamin D in the skin. Having little or no sun exposure can actually put a person at risk for low levels of vitamin D, but too much of it can also increase the risk of skin cancers. The amount of vitamin D in a person's skin makes when they are in the sun does depend on many factors, including skin tone, geographic location, weather conditions, time of the year, and actually time of the day as well. The skin can produce only a limited amount of vitamin D at one time. Vitamin D can also be obtained safely through good and dietary supplements without the risk of associating with the overexposure to UV. But foods high in vitamin D would be like cereals, juices, dairy products, and egg yolks. So I hope you enjoyed this presentation and learned a little bit more about how to prevent yourself from skin cancer, how to appropriately protect yourself from those damaging rays, things like that. So that concludes our presentation today. Do not forget to take the quiz after to make sure you get that credit. So thank you for listening.